Friends, from the Department of Urology at the Kokilaben Dhirubhai Ambani Hospital in Andheri West in Mumbai, I'm Dr. Sanjay Pandey, heading the Department of Urology for the last 15 years. It feels good to connect with society and with active listeners on this channel to make them understand that urinary health is capable of being safeguarded by a urologist. A urologist in your city, in your country, probably would look forward to safeguarding urinary health by meeting you, asking you questions, and looking forward to dispelling myths, looking forward to your treatments happening, and then bringing it back to a fold where health should come to a front row seat, more so urological health, andrological health, urinary health, which unfortunately is missing from public domain. We don't discuss anything on urinary issues, on sexual issues, partly because we are scared, partly because not much knowledge, partly because of a lot of shame, and then whom to go and speak to. Let us speak on topics which are important and relevant on the aspect of awareness. One important topic which actually touches me more frequently these days over the last few decades is about prostate-related issues and more so prostate cancer. After the age of 50s, and prostate undergoes a more rapid change as a result of changes in the hormone, which brings about an internal change in the prostate. We get to see that the prostate would exponentially enlarge, which you check by sonography. It's changes bringing about a progression in urinary problems, and therefore the health going from function to dysfunction. A lot of people complain of urinary flow not being very good, urine having some burning sensation, some bleeding in urine, some possible pain. And in that background, as the prostate is undergoing a hormone change, a small subset of individuals could be going towards a prostate change called prostate cancer. And that's a scary word called prostate cancer. Sadly, it's becoming more common today than it was in the past. Or we perhaps, because of the awareness drives of the kind that I take up forward here and my colleagues and probably the media takes it forward, we're able to reach the society much earlier and pick up more early localized prostate cancers compared to the era when I trained 25 years ago, when more and more prostate cancers would come as spread diseases. So I think it is important for us to discuss prostate cancer over the next few minutes to have a lasting relief on individuals who their family members have had prostate cancer. That we look at that aspect of care, which actually would help me forward to identify and take it to the next level. Let us just open up the subject and take it forward in terms of understanding. Prostate is a hormone-related gland, and on one side, with changes in hormone, its enlargement causes a urinary blockage, which is more common to individuals from different age groups, late 40s, 50s to 80s. Prostate cancer is another completely different lineage altogether, where the change of the entire balance and centricity has brought about a cancerous change that could still be localized if you pick up early on the awareness drives, on the examinations and evaluation, or could actually undergo a spread. Now, because it's a hormone-related cancer, a manipulation of the hormone in spread diseases brings about the burden as decreased as possible in times and treatments where our medical oncology colleagues help us out in times of need. But when you look at prostate and prostate-related issues, a urologist in your city looks at with a pinch of salt in understanding that a prostate cancer can be localized, can be picked up early, can be diagnosed, look at the grade, look at the spread, and treat and cure you. So it's a curable disease. So scare about prostate cancer not being able to get treated is gone completely today. There are various treatment modalities and there are various curative modalities. At the Kokilaben Hospital over the last 13 years since we acquired the Da Vinci robot, various patients in late 40s to late 70s have undergone prostate cancer surgery by me, where we do a radical robotic prostatectomy of the techniques, which could be an anterior approach or a posterior Retzius sparing approach, where we look at removing the gland, which is localized cancer, at the same time sparing the nerve endings to maintain the erections and looking at the continence or control mechanisms. So scare not about a disease which could come to anybody, more so in first-degree relatives of individuals whose sons and whose brothers would actually be at the radar if somebody had a prostate cancer. But prostate changes are inevitable. I always say after 50s, nobody can escape a prostate change. It's all about the capability of us being knowledgeable enough and aware enough that we see our urologist in time to pick up changes which are happening, which are very invisible. The flow gradually going down, changes in the PSA, changes in the prostatic size, and some of them going towards prostate cancer is something which is natural. We need to only pick up diseases in time, because diseases would happen and these diseases would probably be picked up in time and cured by your urologist. So in the cities where you live in, prostate related issues need to be treated by your urologist. At the Coquitlam Hospital in the Department of Urology, on one side, when I evaluate patients for lower urinary complaints, their infections, their burning, their pain, their poor flow. On the side, digital rectal examination, a PSA, and taking it forward to biopsies and suspicious